Hi, I'm Dr. Saro. I'm from Bangalore Baptist Hospital, and I'm a consultant radiation oncologist, and presently I'm heading the Department of Oncology. And when we look at international healthcare tourism, I see a tremendous and potential aspect of that in India, mainly because we have the best of doctors, in the sense well qualified doctors, and who are very updated in their technology, and very updated in their expertise. And I would also say, like a person like me who has been in the field of radiation oncology for the last 12 years, I see there's a tremendous technological advancement in the field of radiation oncology, and I can tell you that India is well and equal with the Western world in terms of technology and expertise. And also, if you look at the various other aspects that are important for India being a healthcare tourism, I think India fulfills all those criteria. We, apart from having good professional and skilled professionals, and as I mentioned, we have good technology. We also ensure that there is a lot of interaction and teamwork among the various consultants from various fields, and we have very good supporting
affordability.
Yes, and also definitely we have good quality of care with very cost-effective treatment. For example, if you look at procedures in oncology, such as radiation oncology procedures, in India the procedures cost about 1/10 of what is there in the Western world. So I would say definitely good quality of care and cost effectiveness would be one of the strong points that India has. What else? What are the other questions you wanted?
What you would like to showcase your specialty and your hospital?
Yes.
That would gain traffic.
Yes.
For India.
Yes.
Of international patients.
Okay. If we are looking mainly at the Department of Oncology, we'll have to understand that cancer is a comprehensive care, and we are first looking at patient as a whole, and we are not looking at a cancer alone, or what type of cancer he has, but we are looking at the patient as a whole, and we ensure that there is a comprehensive care of cancer for that particular patient. Now, once a patient is diagnosed with cancer, there are various modalities of treatment for the treatment. First being surgery, the second being chemotherapy, and the third is radiation therapy. Now, for surgery, depending on which site the tumor is, there is doctors or surgeons who are specialized in those areas to operate. For example, if it is a head and neck cancer, a doctor who is specialized in head and neck cancers will be operating, that is the oncosurgeon will be operating. If it is a cancer of the gynecological cancer, that will be again operated by a oncosurgeon that is trained in gynec oncology. Similarly, if it's a child with cancer, that particular case also will be operated by a doctor that is trained in pediatric oncology or oncosurgery. And then the unit of chemotherapy will take care of patients that have to undergo chemotherapy as part of their treatment, in which in our center we have a medical oncologist, we have a hemato-oncologist that takes care of patients that have to have chemotherapy, and a hemato-oncologist is a doctor that takes care of patients that have cancers such as lymphomas or tumors such as lymphomas and leukemias. And of course, if you look at what we offer at radiation oncology, we have a linear accelerator, that is a machine that delivers radiation therapy, and we have various techniques of radiation therapy such as conventional radiation therapy, conformal radiation therapy, that is what we call as 3D conformal radiation therapy, and we have even more sophisticated technology called the intensity modulated radiation therapy, which has now become the standard of care in many cancers. And we also have a team that is called the palliative care team, which is very, very important and vital whenever there is a cancer hospital or a cancer center. And this the palliative care team supports us in helping us to manage pain for the patients, and also when it comes to a stage when it is difficult to give any more treatment to the patient, or the patient will not benefit from further radiation or chemotherapy, then in these instances the palliative care team helps us with being with the patient and the family till the end of life. As I pointed out earlier, India is definitely a perfect destination for medical tourism, and I cannot advise the government. I am one of an Indian citizen, so I would like to just tell the government, this is not an advice, but I would like to tell the government that let us invest in this option of India being a medical tourism, because we already have the infrastructure for that. We have excellent hospitals that have the latest of technology, that have excellent skilled professionals, and what I could tell the government, and all of us in the healthcare industry could cooperate with the government in investing in this potential of India being a healthcare tourism, by probably looking at having a separate committee or an organization that will help the international patients in finding their way into India much easier, helping with the visas, making travel easier for them, tying up with the various travel agencies that will help them to get earlier travel permits or visas into India, and ensuring that while they are in the country, that a very, very much friendlier system of their stay in India is potentiated by the local police and the others that are responsible for ensuring safety of foreigners in India. I think we can look at safety. That is one of the most important factor, because what I infer from patients who come, and in dealing from patients who come from abroad, is this first part of reaching India and them being in India itself, if it can be made much easier. Thank you to the Healthcare Times for giving me this opportunity and privilege to share this. It's been a tremendous and beautiful experience. Thank you.